Hello. During the next few minutes, we're going to explore various aspects of dental implant surgery. The purpose of this video is to help you understand a method of treatment that might be right for you. And because no procedure is without possible risk or complication, we'll inform you of the potential risks or complications associated with your treatment. Now, let's explore these areas in more detail.
Dental implants are most often used in cases where substantial bone loss has occurred, preventing a comfortable denture fit. Now, when teeth and their corresponding roots are lost, the bone that supported the tooth root is no longer needed, so nature allows it to be lost. Over time, this process of bone loss, called resorption, affects the fit of the denture. Dental implants are artificial root replacement structures placed in the jawbone to provide support for dentures or as anchors for missing teeth. Implants are also used to replace one or two teeth so that a bridge may be placed. Or you can use the implant as a replacement for a tooth or teeth lost to trauma, such as a sports injury or motor vehicle accident. Before developing a treatment plan, we take a thorough medical and dental history to rule out any conditions that could prevent the use of implants. We also utilize diagnostic tests, including special X-ray films, to determine whether the patient is a candidate for an implant. And in some cases, we can remake or adjust the patient's current dental appliance, and dental implant surgery may not be necessary. Alternative treatments include continued use of the current dental appliance, recontouring the jaws through muscle repositioning or skin grafting, building up bone contour with natural or synthetic grafting, or other treatments. If the patient is deemed a suitable candidate and is willing to take on the responsibility of additional oral hygiene that implants require, dental implant surgery may be recommended.
After learning I could have dental implants, I still had some questions. Before going ahead with surgery, I wanted to make sure that I understood what the treatment involved. I read all the literature that my oral surgeon gave me and wrote down my concerns so that I could go over them in detail with the dental implant team.
Dental implant treatment is a team effort that includes the patient's oral surgeon, and general or restorative dentist. The oral surgeon performs the actual dental implant surgery, but it's the dentist who, for a separate fee, creates the crowns, the bridges, or the denture that will be later placed over the implants. The professional team frequently interacts, reviewing films, determining the number and position of the proposed implants, and otherwise working together to plan optimum treatment. A single-stage implant has an extension that protrudes slightly above the gums. In selected cases, the implant may be surgically placed, a cap-like extension attached, and the implant immediately restored with a temporary crown. We call this immediate restoration. In other cases, your surgeon may choose to wait to place the temporary crown to allow the bone to more tightly fuse to the implant. Then, after the usual 4 to 6 month healing time, a permanent restoration may be placed. And during that time, it is important that no chewing stress be placed on the temporary crown. The single-stage process has the advantage of completing the surgical procedure in one visit and improving aesthetics by preserving normal anatomy. There are, however, some slight additional disadvantages to the immediate restoration process. The initial temporary crown does not contact other teeth in order to avoid chewing pressures. Unfortunately, it is often difficult for patients to completely avoid chewing on that implant during the several-month healing period. The primary risk comes when an implant is subjected to chewing stress in the immediate healing period. This makes successful bone integration less predictable. You will be required to eat soft foods during the weeks following surgery to avoid excessive pressure on the healing sites. The 6 months following surgery are critical to successful healing of the implant. During this time, osseointegration takes place, where the jawbone grows tightly around the implant to hold it firmly in place. The osseointegration process is verified through clinical examinations and X-ray diagnosis. Dental implant surgery can take place in either the oral surgeon's office or in a hospital setting. The surgery in the office is generally performed using a combination of local anesthesia and light sedation. Occasionally, general anesthesia is used, and the patient is not conscious during the surgery. The usual side effect of local anesthesia is a few hours of numbness following surgery. Side effects of light sedation and general anesthesia can include disorientation, prolonged drowsiness, nausea, vomiting, and in a small percentage of cases, allergic reactions to the medications and irritation of the vein where the IV has been placed, called phlebitis. And as with any general anesthetic, whether performed in a hospital or an outpatient setting, it may be potentially fatal. If light sedation or general anesthesia is to be used, the patient may not eat or drink prior to surgery to prevent nausea and vomiting during the procedure. Check with your surgeon to find out the specific period of time you must not eat or drink. In addition, the patient must be accompanied to the surgery and driven home by a responsible adult. You shouldn't operate a vehicle or machinery for 24 hours following surgery. Some side effects can be anticipated following the surgery. These can include bleeding, usually for only a few hours, swelling inside the mouth and on the side of the face, some discomfort, muscle stiffness in the jaw or the joint area, and temporary bruising of the face or the lips and beneath the sides of the jaw. Risks also include soreness or cracking at the corners of the mouth. It may take some time to heal. You'll be given detailed instructions to help deal with these occurrences. These can include ice packs for the swelling, pain medications for the discomfort, and methods to control bleeding. If patients experience more than moderate discomfort, excessive bleeding, or have questions, they should call for additional consultation and direction. Good oral hygiene is critical to the long-term success of dental implants. The patient must carefully follow the hygiene prescribed by the dental implant team. Now, this includes regular brushing and flossing and returning for scheduled checkups and cleanings.
So far, we've reviewed the diagnosis, treatment, and alternative treatment of this surgery. No surgical procedure is without risk, so we want to make sure that you're also informed about some of the complications. Your oral surgeon will explain these risks to you prior to surgery. You'll be asked to sign a written consent form to signify your understanding. If you have questions or need further explanation, always be sure to ask.
First, there is the risk of infection. In any surgery, bacteria are always present and may cause infection. However, infections usually respond to antibiotic treatment. And in cases of severe infection, prolonged treatment or hospitalization may be necessary.
Are there any other complications?
Depending on the difficulty of the surgery, there are a variety of risks. These can include loss of the implants due to infection. However, if the implant is lost, we may be able to place a new one after the good bone healing has taken place. Besides swelling and bruising of the face and jaws, risks can include damage to tooth roots, which may later require root canal treatment or result in loss of teeth. Now, before I continue, do you have any questions?
Nothing right now.
Complication associated with surgery in the lower jaw is the possibility of nerve damage. The surgical site is usually very close to several sensory nerves that run through the jawbone. This nerve can be injured during lower jaw surgery, leaving patients with pain or a tingling or a numb sensation in their lip, chin, gums, teeth, or in some cases their tongue. This sensation, which is similar to the effects of Novocaine, can last for days, weeks, or months, and in rare cases, the condition is permanent. Surgery in the upper jaw also bears the risk of complication, since the surgical site occasionally involves the sinus cavity. This may lead to a sinus complication that requires additional treatment, usually with antibiotics, but sometimes will require additional surgery to repair. In jaws that are thin or small, there is the possibility that a fracture could occur, or that the roots of the adjacent teeth might be damaged. Despite thorough planning, surgery may reveal that the patient's jawbone is inadequate, and it may not be possible to complete the planned implant placement. And because each individual heals in a different way, there can be no guarantee of the functional or cosmetic outcome of the planned surgery. Informing patients of the risks associated with dental implant surgery allows them to make decisions about their treatment and have realistic expectations about the results.
Before we close, let's take a few moments to review some questions that many patients ask. True or false, loose dentures are often the result of a natural pattern of bone loss after teeth are lost. This is true. Is the following statement true or false? In many cases, dental implants can help make loose dentures more stable. It's true that in some cases, dental implants can help make loose dentures more stable. An alternative to dental implants is the construction of a new dental appliance. Is this true or false? True. An alternative to dental implants is the construction of a new denture or bridge. True or false? Dental implant surgery must be performed in a hospital. Depending on the particular case, dental implant surgery may be performed in either the oral surgeon's office or in a hospital. Is the following statement true or false? A risk associated with the surgery is injury to the sensory nerve in the lower jaw. True. A risk associated with the surgery is damage to the sensory nerve in the lower jaw. Please consult with your oral surgeon if you'd like further explanation of any of the information in this video, or if you have questions about topics that may not have been included. During the informed consent process, you'll be asked to read and sign a surgical consent form for the procedure just described. Your oral surgeon is committed to not only caring for your physical needs, but also to providing all the information you need to make an informed decision about your course of treatment.